The Senior Rehab Project is supported by the Game Changers, a group of motivated rehab clinicians that are crushing mediocrity and advancing care for older adults. You can join this group of people and get access to the private Facebook group, the monthly meetup with article discussions, and have a say in the direction of this movement. Get off the sidelines and get involved. Just go to seniorrehabproject.com/Game Changers. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults. And now your host, my grandson, Dusty Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. This is your host, Dustin Jones. Today's episode is the recording of the monthly meetup that we had last week. So the Game Changers, which are the people that decide to support the Senior Rehab Podcast and the many things that we do, but also gather together to discuss pertinent articles so we can actually apply some of this evidence that we come across and have some accountability to actually read some articles, because I know I really struggle with actually reading articles and diving into them. So these people have helped me tremendously in doing that. So in November, we discussed the dose of physical activity, physical functioning, and disability risk in mobility-limited older adults. This is the results from the Life Study Randomized trial. This is an open access article, so a link in the show notes will give you full access to that. I highly encourage you to read it. Definitely pertinent to our work, regardless of your setting, and you'll definitely hear that in this discussion that I'll start after I read the abstract for you. So, understanding the minimal dose of physical activity required to achieve improvement in physical functioning and reductions in disability risk is necessary to inform public health recommendations. To examine the effect of physical activity dose on changes in physical functioning and the onset of major mobility disability in the lifestyle interventions and independence for elders, the Life Study. We conducted a multi-center single-masked randomized controlled trial that enrolled participants in 2010 and 2011 and followed them for an average of 2.6 years. 1,635 sedentary men and women aged 70 to 89 years who had functional limitations were randomized to a structured moderate intensity walking, resistance, and flexibility physical activity program or a health education program. Physical activity dose was assessed by 7-day accelerometry and self-report at baseline and 24 months. Outcomes included the 400-meter walk gait speed, the short physical performance battery, or SPPB, assessed at baseline, 6 months, 12 months, and 24 months, and onset of major mobility disability, which was objectively defined by the loss of ability to walk 400 meters in 15 minutes. When the physical activity arm or the entire sample were stratified by change in physical activity from baseline to 24 months, there was a dose-dependent increase in the change in gait speed and SPPB from baseline at 6, 12, and 24 months. In addition, the magnitude of change in physical activity over 24 months was related to the reduction in the onset of major mobility disability. Here's some stats that I'm not going to read in the physical activity arm. We observed a dose-dependent effect of objectively monitored physical activity on physical functioning and onset of major mobility disability. Relatively small increase over 48 minutes per week in regular physical activity participation had significant and clinically meaningful effects on these outcomes. So I know that's a mouthful, but I highly encourage you to keep listening and hear the discussion where we kind of recap some of the things that we learned and some of the critiques of the article, but how we can apply that regardless of the setting that we work in. So without further ado, the discussion with the Game Changers. All right, folks. Senior Rehab Shorts with the Game Changers. We are talking about dose of physical activity, physical functioning, and disability risk in mobility-limited older adults. Results from the Life Study Randomized trial. I'll read the abstract in the intro. So we were just talking about all the practical applications of this study, how we will change our practice, the implications that this pretty awesome article has. So let's start off Jamie, what in particular did you really like about this study, or what did you feel like made it kind of unique?
All right. Well, this is Jamie Lilly. I really enjoyed this study in particular because it was a longitudinal study looking at physical activity over at least a 24-month period. It also followed the participants through events in that particular time span, including hospitalization. And what we found that was really surprising in some respect is that the outcomes in terms of improvement from physical activity happen regardless of things like those hospitalizations. So it came across as being very realistic in terms of the patient population that we work with, and had a lot of good carryover into what we might incorporate into our own programs. And it also utilized some very well-regarded specialized and standardized tests for their outcome measures that I think a lot of different clinicians already incorporate into their practice. So they're things that we're very familiar with. And from that sense, a lot of their results in some regards, I find we have the potential to duplicate in our community of adults that we work with.
Yeah. Yeah. And so we definitely discussed about how to implement some of these, just some of these results, some of these recommendations. But there are several barriers. So let's just kind of go through just some of the issues that I know a lot of the listeners may be thinking about when we're talking about increasing physical activity. But I guess we can just kind of go by, just setting specific. So Nicole Nexon is with us. Nicole, can you speak to, potential barriers, just given, your experience and, kind of where you're working in terms of increasing physical activity?
Sure. So I'm in a skilled nursing facility, and some of the barriers we have found is that what was being noticed in the building is that as people were getting more mobile, and as we were encouraging more activity, they were at a higher risk for falls. So it became a matter of how to encourage activity without really elevating people's fall risk, because the last thing we want, even though the study shows that hospitalization, allows you to still get results, we don't need people going to the hospital with fall injuries. So that's something no one wants to deal with. So one of the things that we've been doing is making, with the patients who are cognitively able to make decisions and kind of almost make a deal with us, to sneak in extra activity, we'll do things like almost trade privacy for a little more mobility. So, if I have a patient who I know can transfer safely and is walking with me safely, I'll say, I know you can go to the bathroom by yourself with the wheelchair, but I'd like you to walk more. So if I give you a walker, will you call the aide? And will you accept having supervision to go to the bathroom instead of the privacy to do it yourself? And I'm actually finding that people are receptive to that because they do want to walk more. I mean, you're going to find people who want the privacy more and they're safe like that. And I'm fine with that. It's definitely a personal thing. But I do find that people are willing to trade that little bit of privacy for, the ability to walk more, to be on their feet. And so people who will go to the dining room for meals, I'll have them, I know you can go by yourself, but would you be willing to walk with an aide instead of taking the wheelchair? And when they're not safe to walk, or I don't think that they're going to be willing to make that bargain, I always encourage more time out of the room in the wheelchair. Take your wheelchair, go get coffee, meet your family down in the lobby, go check out the library, all of those things, just to get people to do more, just to sneak in that little bit of extra activity, because they're in sessions for 2 hours a day with therapy, PT/OT, but there's so much more time that they're not doing anything. And if I can get them to be moving more, it's more functional for when they go home, but also I can get in that little bit of extra activity. I'll take it.
Yeah, that's true. And I think, we all kind of echoed this, but that was the encouraging part of this study, is that it showed that over 48 minutes a week of moderate intensity physical activity had awesome results in these really good outcome measures that Jamie mentioned before. We'll take what we can get. A little bit goes a long way. Troy, can you speak to kind of your perspective, just interacting with the different disciplines? You're in home health. how do you see this type of encouraging information being able to I guess, be executed on a team level and not just PT? You think that that's possible?
Yeah, so I think some of the implications that you're seeing, that you can see from this in the home health studies, it can really help strengthen that interdisciplinary approach that we kind of look for in home health. Sometimes, when you're out in the clinic, as different clinicians, we all kind of get in our little silos. We have our own little filters. We have that nurse filter, that PT filter, that OT filter. But when it comes to it, at the end of the day, we're all trying to work towards the same goals, to keep our patients improving, to keep them out of the hospital, to keep them really in the setting that they want to be, which is in their home, and keep them happy and getting back to their life. So I think just with this, it's showing that we can, even all disciplines can just encourage that patient to increase that physical activity, whether they have PT in or they don't, or they have OT in or speech, or if it's just nursing. Just increasing that physical activity to 7 minutes a day can really show improvements in the quality of lives for our patients.
Mm-hmm. Awesome. Tally, could you speak to kind of your situation and what really stuck out to you with reading this article?
Yeah, it's kind of like what was just said. For me, since lately, I've been working a lot in the in the jury psych unit, and I have patients of all kind of let's say either mental illnesses or cognitive decline, and a lot of them, especially the ones that suffer from schizophrenia, get very paranoid if you do a long session, and a long session can be even 10 minutes would be long for them, and they will get pretty paranoid about who you are, what do you want from me, and so for me it was very encouraging that even something like 7 minutes a day can be useful, because I have been, even before this article, kind of breaking the session for very short periods of time before they get to a critical level of either paranoia or just agitated, and so it was a really encouraging article.
Mm-hmm.
That even those 7 minutes are okay and they're good, but as Nicole said it before, it should be 8 so we can bill
it. Nicole's not going to defend herself, I guess.
Nope, I stand by that.
I do too. I totally accept it.
That reminds me of I did a contract job in a skilled nursing facility. And I had no clue the whole billing structure and whatnot. And I did an eval, and then the next day the patient's on my schedule for 90 minutes. And this patient was not appropriate for 90 minutes of physical therapy. I mean, they would fall asleep, within 1 minute of me not interacting with them. And I remember it was terrible. I mean, it was just, I was racking my brain on how to do physical therapy for 90 minutes with this patient, but now it makes me feel a little better that if I got 7 minutes, good to go. So Jamie, you had a good point about just some of, I guess, the added benefits of the results of this study, what it showed, and definitely from kind of the population health perspective. Could you kind of wrap us up with your thoughts on that?
Yeah, so one of the things that we kind of looked at and talked about is the fact that because we're only looking at a 48-minute time span in a week, if you divide that out into each day, it creates a really good opportunity for our patient population to engage in physical activity over the course of a day and not feel like they're having to spend all of their day doing exercise. They can do 3 to 4 minutes here and a couple minutes there, but increase the intensity of the activity that they're doing and do it for a shorter duration and still get the benefit of it. And I think that creates a lot of great opportunity for us as clinicians across the spectrum of our settings, because now we're giving the patient the opportunity to do things on their own. And granted, in skilled nursing, you do have some issues there in terms of supervision and some of those folks that might have some cognitive challenges. But I think overall, we have a really good opportunity with this.
Yeah.
Dustin, I just wanted to add, not only with like staff and the people who can do things on their own in the facility, I've also found that some families are very willing to work with you, and they're very willing to listen. And so when I find families that are willing to work safely with the patient, like within what we've discussed, I am more than willing to help them be more active with their family members. So I will do gait training and exercise routines with family members. So when they're visiting, they can push their family to do a little bit more. So I feel like this is a good opportunity for that also, because maybe they'll walk, get an extra walk in with like a son or a grandchild. And that's always a win, I feel. Yeah.
What if it's 7 minutes of moderate intensity of ankle pumps? Troy Mead asks. No, thumbs down. Troy knows
have our eyes.
Oh, well, awesome. All right, so listeners, that article, the link will be in the show notes. We'll link to the abstract. Dose of physical activity, physical functioning, disability risk, and mobility limited older adults, results from the life study randomized trial. So it has some practical implications for us, regardless of your setting. So take this information, use it, and thank you to the Game Changers for reading this article, holding me accountable, and discussing it. Hit me. Thank you for listening to the Senior Rehab Podcast. If you enjoyed this content, I highly encourage you to go to seniorrehabproject.com, where you can find more helpful episodes, lots of free resources, and to see how you can become a game changer and influence the direction of this movement. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky.